Overcoming social anxiety. What is social anxiety disorder? People with social anxiety experience a persistent fear of social situations in which they think they'll be judged or humiliated. This leads to avoidance, impacting their ability to make friends, go to school, get a job, or be successful at work. Things that may cause a person with social anxiety to feel discomfort include walking into an unfamiliar place, such as a gas station or store, using a public bathroom when someone else is there, being asked to introduce themselves in front of a group, entering a room full of people, eating in public, having to ask for directions or help, speaking with an authority figure, giving a presentation, going on a date, using public transportation, or being the center of attention. Social anxiety disorder can feel like being under a spotlight. The spotlight is uncomfortable, and the person with social anxiety may go to great lengths to avoid it. With social anxiety, the anxiety response is disproportionate to the trigger. For example, while it's normal to feel anxious before making a speech, it's not normal to experience intense fear or distress. Signs of social anxiety include blushing, sweating, stuttering, a rapid heartbeat, avoiding eating or drinking in public, avoiding using public restrooms, making limited eye contact, rigid body posture, hoarseness or vocal changes when speaking, or diverting attention to others. Social anxiety is often misunderstood or goes unrecognized. People with social anxiety may not seem anxious, even to those who know them well. This is because they have learned to hide their anxiety or disguise it as something else, such as disinterest or a lack of awareness. For example, they may attempt to mask their anxiety by being overly talkative. Or, they may seem the opposite of nervous, overconfident or arrogant, having trained themselves to not appear anxious. Social anxiety differs from a personal preference for avoiding social events. People with social anxiety may enjoy social gatherings, where they feel comfortable and safe, such as with close friends or family members. However, they may avoid other enjoyable social events due to their anxiety. Who is at risk for social anxiety? In the United States, social anxiety disorder affects approximately 7% of the population, with higher rates in women and younger adults. Social anxiety is typically diagnosed in childhood, between the ages of 11 and 13. It may start as shyness, but can develop in response to a significant, humiliating event, such as being bullied or having an accident in public. How is social anxiety treated? Treatment interventions for social anxiety disorder include medication and psychotherapy. Antidepressant medications, such as Paxil or Prozac, are first-line treatments for social anxiety. Another type of medication, a beta blocker, can be prescribed to treat the physical symptoms of anxiety. Beta blockers work by blocking adrenaline, which reduces a person's heart rate and helps with tremors. Cognitive behavioral therapy and exposure therapy are highly effective therapeutic approaches for managing social anxiety, especially when combined with medication. What are some in-the-moment coping strategies for social anxiety? If you have social anxiety, there are a number of things you can do when you're feeling overwhelmed. Here are 7 strategies. 1. Self-talk. Talk to yourself in a positive and reassuring way. Tell yourself that whatever you're facing, it can't kill you. You can also try repeating a mantra to yourself, such as, "This is nothing I can't handle." 2. Remind yourself that it's normal to make mistakes. When you feel embarrassed about something you did, remember that everyone makes mistakes and experiences social awkwardness. 3. Learn to laugh at yourself. Don't take things so seriously, and try to see the humor in situations when you can. 4. Talk about it. Although it may seem counterproductive, some people find it helpful to purposely bring attention to their symptoms. For example, before a presentation, lead with, "Hi everyone, I won't lie, public speaking makes me incredibly nervous. But I'm excited to be here, so bear with me." Not only does this take the power away from your anxiety, most people will be able to relate, or at least sympathize. 5. Play the "so what" game. This is a helpful strategy for challenging your negative and distorted thoughts. Ask yourself, so what? What's the worst that could happen? Once you've identified the worst case scenario, you'll realize it's not as bad as you thought. 6. Dim the spotlight. This is an avoidance strategy, not a long-term solution, but it can help you survive when your anxiety is through the roof. The strategy is to make yourself less noticeable. This could mean standing behind a podium, or wearing a scarf with your hair down to hide blushing. You may actually build confidence this way, to the point where you no longer need to make yourself less noticeable. 7. Bring a buddy. Oftentimes, it can be helpful to have someone with you for moral support. If you're going to be in a stressful social situation, have a friend, or family member, tag along. This can help you to feel more confident, and less alone. Always keep in mind, there is no one-size-fits-all approach, so experiment, until you find what helps you the most. Living with social anxiety isn't easy, but you're not alone. With each and every challenge you overcome, you'll discover a more confident you. You are stronger than you think, and you are worthy of connection, belonging, and happiness.